mynews.studio.
Imagine if a single shot right after birth could prevent millions of deaths from liver cancer. The question is, if that's possible, why isn't it happening everywhere?
Today's date is August 1st, 2025. Let's dive in. The Lancet just released an analysis saying up to 60% of global liver cancer cases could be prevented. That's a staggering figure. What's behind this potential breakthrough?
It really comes down to three things: hepatitis B vaccination, diet changes, and reduced alcohol use. If we zero in on hepatitis B, the vaccine is already out there, proven safe, proven effective. But even so, liver cancer remains the third leading cause of cancer deaths globally. So, what's causing this gap between what we know works and what's actually being implemented?
A lot of it seems tied to bigger systems. Many low- and middle-income countries still struggle with healthcare infrastructure, not to mention funding and getting vaccines out to rural communities. But there's also a social side, right? Like misinformation or local beliefs making people hesitant about vaccines.
Exactly. Even when the vaccine is available at no cost, uptake depends on trust. Plus, that first dose needs to be given right after birth, and that requires mothers to deliver in facilities that can provide it. In places where home births are the norm or clinics are far away, it's easy to miss that early window.
So it's not a case of having vaccines in storage but not using them. How do countries with high hepatitis B rates manage to improve coverage? Are there approaches that consistently work?
Yes, some governments have built hepatitis B vaccination right into their national immunization programs. When the first dose is standard at birth and offered for free, coverage climbs rapidly. For instance, areas in Southeast Asia saw rates rise from under 50 to over 90% after rolling out these policies.
That kind of increase is significant. But hepatitis B isn't the only thing driving liver cancer, is it? What about other lifestyle risks?
That's right. Alcohol and poor diets are also major drivers. Public health campaigns focused on reducing alcohol use and improving nutrition have shown they can help. Still, there's resistance. Sometimes it's cultural attitudes toward drinking, sometimes limited access to healthier foods, and often it comes down to awareness.
The report mentions using community figures, even religious leaders, to get the message out. Why does that seem to work better than messages from health authorities?
It all comes down to trust again. People tend to listen to those they know, local health workers, faith leaders. When these community figures organize vaccine drives or health sessions, the advice carries more weight. The key is communicating in ways that fit the local context.
But what about the costs? Integrating all of this, vaccines, education, outreach, can't be cheap. How do countries actually manage to pay for it?
There are a few solutions. International support plays a big role. Organizations like Gavi help fund vaccines, public-private partnerships, and including hepatitis B vaccines in broader maternal and child health programs also help spread out the financial burden. Ultimately, it's not just about money. Reliable logistics and steady political commitment matter just as much.
If we know these approaches work, what's holding back a worldwide rollout? Is it just a matter of priorities competing for attention?
That's part of it. There's always something urgent. Conflicts, pandemics, budgets stretch thin. But the evidence is strong. If we act now, we could prevent somewhere between 8 and 15 million deaths over the next generation. This isn't theoretical. It's based on what we already have.
And this approach, does it only change the story for liver cancer, or could it be a blueprint for preventing other diseases too?
It absolutely sets a model. If we can do this for liver cancer, similar strategies could work for measles, cervical cancer, some forms of diabetes. It's about blending vaccines, policy, and real community engagement.
So the real question is whether leaders will act on the evidence or whether we'll be having the same discussion 10 years from now, with even more at stake.
That's what's at stake. We have the tools. The next step is taking action, coordinated, ongoing, and adapted to each community's needs.
We started by asking why proven solutions aren't being used. The answer, as we've heard, is complicated. Resources, trust, logistics, and whether there's enough determination to follow through.
Thanks for listening as we explored what could be a turning point in cancer prevention. The steps are clear. Now it's about keeping momentum.
Thank you for joining us. This episode comes to you from mynews.studio. Try it now at no cost.